I'm giving you 8 strange warning signs of kidney disease that might seem like something else. Number 5, muscle cramps. Yes, muscle cramps can definitely be a warning symptom of kidney disease, typically when the kidneys are not filtering electrolytes properly, like potassium. So if you have a kidney condition that's causing you to dump out potassium, okay, get rid of too much potassium, then that can lead to hypokalemia or low potassium in the blood, which can cause muscle cramps or like a Charlie horse. Typically, oh my gosh, like in the calf, it can be really just like a tight contraction of the muscle. That's an issue. Also, if you have fluid balance disturbance, that can lead to having muscle cramps. So definitely, if you're having muscle cramps, talk to your doctor. Make sure they check out your electrolytes, your potassium, your calcium, your magnesium, all of that. Now, muscle cramps can be a kidney warning symptom, but it can be confused with something else because other things that can cause muscle cramps are just outright dehydration. Okay, you might need to just grab a bottle of water or two. Also, you might be having muscle cramps due to overuse injury. Okay, maybe you went to the gym and you kind of overdid it. And now your muscles are cramping up. Okay, they're tightening up. Poor vascular flow. Okay, if you have peripheral artery disease or PAD, or even peripheral venous disease, okay, you can have an issue with cramping. So you want to make sure that you have proper blood flow, okay? Some other things, yeah, you can have electrolyte disturbances for reasons outside of kidney disease. For example, if you've been put on a water pill or a diuretic, that might be causing you to dump out a lot of potassium and causing your muscles to cramp. Either way, if you have muscle cramps, it could be one of these strange warning symptoms of kidney disease. So talk to your doctor. Check it out. Number 6, swollen ankles. Oh my gosh, if I had $1 for every patient who walked into my office with swollen ankles and I ended up diagnosing them with kidney disease, well, I'd be a billionaire. Maybe not. I don't know, but it's a lot. At any rate, swollen ankles definitely can be a warning sign of kidney disease. And this is what happens. Well, it can be for a few reasons. For one, if you have kidney disease, then you may have an abnormal way in which you're maintaining your salt balance, okay? So if you have too much salt in your blood vessels, then that can draw in water, and then you can get swollen feet and ankles. Also, if you have kidney disease and you are no longer making as much urine as you used to make, well, then you might have a backup of fluid in your body, okay? That can lead to swollen ankles. Another thing, if you are losing protein through your kidneys, like through nephritic syndrome or nephrotic syndrome, that could mean that, okay, this is what happens. Your protein or your albumin is inside the blood vessels and it acts like a sponge to help to keep fluid inside the blood vessels where that fluid belongs. But if you have a disease like diabetic nephropathy or FSG, focal segmental glomerulonephropathy, or even HIVAN, HIV-associated nephropathy, well, then you could be leaking a lot of protein through your kidneys into the urine. And so now you no longer have that sponge inside of the blood vessels. What happens? Well, that means that the fluid can leak out and you can get swollen feet, ankles. You can also get a whole swollen body or anasarca, generalized edema. Now, usually this will give you a pitting edema. And what do I mean by pitting edema? I mean, if you take your finger and you press down where the swelling is around your ankles or your feet, then it will leave a pit, okay? If you put a few fingers, or like 3 fingers, then it'll leave the imprints or the pitting of your 3 fingers. That's pitting edema. Swollen ankles from kidney disease can be confused with something else, okay? It's another one of these strange warning signs that can be confused with something else. So what else can cause swollen ankles? Poor circulation, congestive heart failure, vascular disorders like peripheral vascular disease. Also, prolonged standing or sitting. Yes, just the gravity can cause you to have swollen ankles if you have prolonged standing. It's not necessarily kidney disease. Be sure to check out my YouTube video, What is Nephrotic Syndrome, after you finish watching this video. Number 7, poor appetite. I can't tell you how many times a patient will come in and they'll have weight loss, they'll have a poor appetite, and they're just not sure why. Oftentimes they're very happy about it. They're like, oh, doc, I've been trying to lose weight all these years. I know you're saying my kidneys are getting worse, but boy, my weight is dropping. Well, your weight might be dropping if you have advanced kidney disease leading to a poor appetite. And the poor appetite may be due to uremia, again, that buildup of kidney toxins in the blood causing you not to want to eat the way that you used to eat. It could also be due to a change in your gut microbiome associated with the kidney disease. So other things that can cause poor appetite that could be confusing. Well, if you have just a general illness from something else, like a cold or the flu, or if you have some other type of a chronic illness like cancer, lots of things can cause a poor appetite, but kidney disease is definitely one. Another big one is stress. We know that stress can decrease your appetite. Either way, if you have a poor appetite, make sure you know your numbers and you rule out kidney disease. Number 8, metallic taste in mouth. Y'all, this is a big one, okay? Because if you have a metallic taste in your mouth, this could be a warning symptom that you have advanced kidney disease and uremia. What happens when you have a buildup of toxins is that literally you get this metallic taste, or you may describe yours as something else, but metallic is what most of my patients describe it to me as. But you get this weird taste in your mouth, this metallic taste in your mouth, and you're just not hungry. Even your favorite foods, the spicy foods, the totally rich foods, the flavorful foods, you're just not interested because your mouth tastes funny. You have a metallic taste. If you get this, please contact your physician immediately because there's a great chance that you could have some very serious kidney disease. Still, this is one of those warning symptoms of kidney disease that could seem like something else. If you have certain dental issues, you might get a metallic taste in your mouth, especially if you have hardware or if you have some type of infection in your mouth. Also, if you're on certain medications, there's certain medications that can give you a metallic taste in your mouth. Either way, you need to consult with your doctor to be sure that the metallic taste is not due to kidney disease. So these are 8 of the strange warning signs and symptoms of kidney disease that might seem like something else. Question: which of these warning signs was the most surprising to you? Let me know in the comments.